Hello, Dog TV. Joe Myers back here, home office in Minnesota. Dog TV chats for another episode. I want to welcome our incredible, illustrious guest today. You might have seen him on such shows as Rachel Ray, The Doctors. He was honored by Purina as the Media Man of the Year, Media Personality of the Year. So please welcome Dr. Courtney Campbell.
Joe, it's great to see you, man. It's fantastic to be here.
You as well. Thank you so much for joining us for this social distancing Dog TV chat. I want to tell our audience a little bit about your background. You're a board-certified surgeon, a veterinarian. You also host a show, Vet Candy, here on Facebook Watch. How are you doing today? How's everything going in your world?
Listen, Joe, it's been a really interesting time, and it's incredible because throughout this entire crisis, this has just affected everybody nationwide. And, you and I could have chatted about veterinary medicine just in general, the new normal, and how things are going, and kind of update the profession, the industry, and all those pet lovers out there. But now, literally everything is looked at through what I describe as the coronavirus era or the COVID era. And the reason I bring that up is because this era that we're experiencing, this strange time, and for some parts, tragic time, it's going to fundamentally change the way that we interact with each other and the way that we interact with pet parents out there, animal lovers out there, and just how we are as an industry. And I think it's really important to talk about because I don't think we're going to be the same after this, but that's not necessarily a bad thing. I think we're going to be a lot more conscious in a lot of ways and connected in a lot of ways after this is over.
Agreed. I heard somebody talk about maybe handshakes are a thing of the past. We'll ask tell our kids, like, back in my day, we used to give each other our hands.
Absolutely, man. Listen, I mean, not only handshakes may be a thing of the past, but I think we'll have a new perspective on how we just deal with interpersonal communication and the value of a hug or the value of a handshake or just being close next to somebody and understanding, like, this, you can't necessarily take this for granted because it's not going to be like this all the time, or there's going to be times where this is a premium or a privilege,
Agreed. So audience, if you're watching right now, we are live. If you're watching this live, of course, please feel free. If you have any questions for Dr. Courtney about veterinary medicine, about the coronavirus and its effects on pets, or about just general veterinary questions you have about your dog, he'll try to answer them as well as he can. Of course, in any emergency situation, contact your local vet. But we would love to answer any of your questions related to your pet. So, Doctor, what is happening in the state of the industry? I imagine you have other friends that are vets, people that you went to school with, or people that you've worked under. What is the tone or the vibe in the industry right now?
Well, the tone and the vibe is literally trying our best to be responsible, trying to just exude a really high level of public health responsibility. I mean, picture this, you are a pet parent, you're experiencing some odd sign or sickness in your dog and your cat, and you want to bring your pet to the veterinarian, and you're anxious about that, and you're wondering, how is this appointment going to go? Or let's say you're comfortable and you've been through this process before. There's a whole new normal now. When you are about to schedule that appointment, you're going to give your veterinarian a call first and say, hey, are you guys still open? Number one. Number two, your veterinarian may receive you once you drive into the parking lot. A technician or a nurse may come out donned in personal protective equipment, gowns, masks, gloves. They're going to retrieve your dog from, your car. They're going to remove harnesses, leashes, and then put on a brand new leash. Bring your dog in. Your veterinarian is going to do the exam in the hospital, and then give you a call to let you know exactly what they're found, what diagnostics they'd like to run. They may even ask you, hey, is your pet scheduled for an annual physical exam or an update on some medications or vaccines? And they may ask you to postpone those appointments. So we're living in a whole new normal and a whole new era. And I think it's important to let everybody out there know that these changes may be consistent, and they may be there for a really long time. So that warm, fuzzy feeling that you get, that that handshake that you described, and just meeting your client or your patient, in this case, the dog or cat, that warm, fuzzy feeling you're getting, now you're 6 feet away or you're over the phone. So things are definitely different.
Gotcha. How can us as dog owners, I have a dog myself, a little beagle named Mickey. How can we be the best partners for our veterinarians? What can we do at home with our dogs? And then how can we help when we have an issue, potentially support our veterinarians in this unstable, unsettled new normal?
Well, I think looking at that particular question is, how can pet parents just be more responsible in this era where there's increased attention towards public health, and particularly through the prism of coronavirus? First, let's tackle just through the prism of coronavirus. Number one, I was talking to a young lady the other day. She said she was just on a hike. There was nobody else around. She was very socially distant or physically distant from a lot of people. But around the corner came this really happy golden retriever, and just bounded right up to her, and just out of reflex, she couldn't help it. She just reached out and started petting her dog, petting that golden retriever. And she saw the pet parent in the distance, and the pet parent said, "Hey, what are you doing?" And she realized right at that moment she may have messed up, because here she was just interacting with herself, just enjoying it. And she sees this super sort of amiable, friendly golden retriever, and she starts petting it, not unwittingly realizing, like, hey, we should be actually physically distant. We shouldn't be contacting. So I think just as responsible dog owners, pet parents, animal lovers, I think it's really important to stay social, right? Don't be afraid to say hi. Don't be afraid to call. Don't be afraid to spark up a web meeting. But be physically distant, so that you are maintaining 6 feet distance. You are making sure you indulge in diligent hand hygiene, and as well as being hygienic when it comes to physical objects. So I think that's number one, just through the prism of coronavirus. But then number two, how can people at home help the veterinary industry? And that is just making sure that we aren't using personal protective equipment at home that could be used for those on the front lines fighting this coronavirus, and those putting themselves in harm's way, helping people who are affected with COVID-19. We have, I was speaking about this on a podcast recently about the use of surgical masks, and how they are best left in the hands of medical professionals who may be experiencing a shortage. Now, that may change in the future. Maybe you may see more widespread use of masks and personal protective equipment, but I think overall it's really left for those who are on the front lines of this. So all of those things, and maintaining your physical distance, maintaining disinfecting inanimate objects like leashes, collars, harnesses. These are all great ideas and best practices.
That is so true. I was, taking our dog on a walk, and we saw this dog there, and my natural inclination as a dog person was to ask the parent, of course, as always. Right. But I was like, oh, okay. I'm just gonna observe from afar, and maybe someday in the future we can. But those are perfect advice.
Well, it's really tough, man. I mean, listen, my heart goes out to you, because veterinarians, we experience that same feeling. I mean, we love to just get down on the floor with the pets and just, wrestle for a little bit before we do our exams, or greet our new patients, or our favorite patients, favorite clients. Yep. And that's why a lot of us are so passionate about this field. And having that distance now puts a separation not only between you and your client, but of course between you and your patient, which is why we got into this originally.
Exactly. Yeah. The one thing of the love and the happiness and the joy that it's experienced. And we've even, we were talking to somebody last week about the cortisol that's released when you pet your dog, and it releases these happy endorphins. So maybe just pet your own dog, stay away, and social distance from the other. A good reason to get a dog.
Yeah, exactly.
This new normal. One thing we've talked about briefly is telemedicine and telehealth. Is that something that you've experienced with? Is that something that you've seen such a switch to? And how can we be better users of telemedicine?
telemedicine and telehealth in the veterinary industry was coming, right? It is the new frontier and it is approaching rapidly, but nobody expected that it would occur this rapidly. Nobody thought that we'd be accelerating towards the level of telemedicine and telehealth like we have been. So, when I mentioned before, calling your vet's office prior to make sure that they're still open and finding out what are the new protocols that are in place as far as showing up for your appointment, a lot of times veterinarians may actually engage in virtual appointments or through video. And I've been engaged in a lot of these. Send me a video, I might say, or send me a picture of what you're talking about, or let me chat with you over the phone or through, a streaming app, because that is the new frontier. Now, sometimes these are difficult appointments to get through, right? Because I'm not sure, does the client actually enjoy that interaction through this virtual connection? Or I may be allaying fears like, hey, that cough is just something that will resolve on its own, or hey, that cough sounds a lot like pneumonia. If you have a skin rash, you look at that skin rash, you say, hey, that just needs some antibiotics, or maybe that might need to be biopsied. So there are things that are happening in the world of telemedicine that are hurdles that we're going to have to get through. It's not like the human side where our patients communicate in ways in their own language, right? And so that also creates that divide. But I would say 100%, we are really, we're on a new frontier. We're accelerating fast towards telemedicine and telehealth. And I think it's on the frontier. It's here to stay. A couple of things that I think are really exciting is a lot of these new fitness trackers, smartphones, and technology. And so what you might have is either microphones that pick up, let's say a pet is coughing, and they can analyze that through that algorithm and say, hey, that cough sounds more severe. Or you've seen this on the human side where just simply placing a sensor over your heart, you can actually see through the smartphone an EKG tracing, to see what that heart looks like. So there's all sorts of smartphone apps and digital technology that I think is going to just jump right in to veterinary medicine, and I'm excited about it. But I've been doing it myself for the past 3 weeks.
Oh wow! Yeah. What an interesting time to be a part of it. If you have any questions for Dr. Courtney, please feel free, add them in the comments. This is live, not recorded. I'm here. We're both here.
You never know what might happen on live, right?
Who knows, right? It could be a lot of fun. The other thing that is sort of sweeping the nation, and I think in an effort to maintain some of these PPEs, is limiting services at veterinary offices to urgent or unstable. What's a way for a pet parent to sort of understand the difference to alleviate your veterinarian at times?
Yeah, I think to your question, man, it underscores, when should I bring my dog to the vet? I mean, that is like a whole new, there's a whole new attention placed upon that question, and it's spot on. So I think as far as when should you bring your dog to the veterinarian? When is it an emergency? Here are some tips that I would definitely emphasize. If your dog is having trouble breathing, okay, that's number one. If your dog is having trouble walking, if they're struggling to get up, urination, defecation, if your dog is having trouble with any of these sorts of things, that is super important. If your dog has had a condition, let's say you found a mass or a tumor on the leg, or let's say he's always had a heart condition or a liver condition, and if you've seen an acute change to that condition, meaning it gets worse suddenly, then these are definitely times where now you know that something has acutely changed. And so I would definitely describe dogs who cannot walk, or cats who cannot walk, or dogs who cannot breathe, lack of urination, defecation, something on your dog that's an underlying condition that has suddenly gotten worse. These are all conditions where it's like, all right, I absolutely need to bring my dog to the veterinarian. This is what I would call urgent and unstable. Excessive hemorrhage. I just saw a dog, unfortunately, 2 days ago, a young German Shepherd who stomach was huge. Just his abdomen was like a balloon, tight like a balloon, and his stomach had flipped, which is a condition we call gastric dilatation volvulus, where the stomach actually flips 180 degrees. It traps gas and air and food. And dogs, obviously, it's a potentially a fatal condition if not treated surgically. So at about 1 a.m, we are doing surgery, putting the stomach back in the right position, and then we sew it along the side of the body wall just to make sure that this can never happen again. It's called a gastropexy. But I think ultimately that family fortunately recognized
questions coming from our audience. So thank you, audience, for that. Do you have any special games or enrichment activities that you recommend with dogs?
Well, that's such an important question because a lot of people are stuck at home. Like 95% of Americans are under a provision to shelter in place or stay at home. So if you're stuck at home with your dog, you've got to figure out how do we enrich the environment. I'd like to say, number one, that probably the most simple activity would be some straightforward obedience training, and straightforward interactive training. Teach your dog new tricks if you want to. I think, when I say new tricks, what I really want to emphasize is I think the most important trick, and I put this in air quotes, is that connection, that recall command. So if your pet's in danger or you want your dog to come to you immediately, you want to strengthen that bond so that no matter what they have going on, no matter what they're distracted by, you can call them and they'll come to you immediately. And I would just work on that 5 times a day. Sit, stand exercises, have some fun. Of course, the paw command is always great. Sometimes what I found people doing is playing whack-a-mole with their dogs, in that they'll have a high value treat. Let's say something like low-calorie deli meat or green beans or something like that. And they'll just cut holes in boxes, put it on a stick, and just stick it through the holes in the box and just see where their dog has to anticipate, all right, which hole is this coming out of? And occasionally they get a little nibble, and it just keeps them fun. It just keeps it fun and keeps it like relatively interactive. And so everything from regular old obedience training, a walk outside, very physically distant from people,
for sure.
Just whack-a-mole, just tips and tricks, things. This is a great time to actually learn how to do a little bit of a home physical exam as well. Do you know where your dog's pulse is? Do you know what a normal dog's heart rate and breathing rate is? Do you know where your dog's lymph nodes are? Because, Joe, if you know normals, then when the abnormal pops out, you can detect it really, really well. So I think these are and then of course the disaster kit, right? If you've been planning on, okay, it's on my to-do list. I always wanted to have a pet first aid kit at home in case there was a medical emergency, but I've never actually gotten that together. Get a list together, and then make that at home so that you have a go bag in case your dog ever experiences something like that. These are all things to do while you're at home.
Perfect. And then another question from our audience is, what advice do you have for recent or soon-to-be vets out there who maybe are about to walk or virtually walk across the podium and are stepping into this new environment, as we call the veterinarian world?
Well, first, congratulations to all those young vets out there who are graduating, even those in specialty medicine, all those coming out of their residencies, and those specialists out there. And so congratulations first, but then second, I'm sorry. I'm sorry you had to come into the industry during this COVID era, but we need you more than ever. It's an exciting time, and you're going to have a really happy and fulfilling career. But as far as how do you handle this era that we're living in, understand that it will be better soon, right? We won't be living like this for a while. Hang in there because things will improve. Make sure that you essentially stay flexible and stay nimble. You may have a particular interest. Let's say it's ophthalmology or wellness or health and wellness. And the attention right now, for good reason, is focused on coronavirus and protecting the public health and our pets from or at-risk people. There may be that attention right now. And so be flexible, be nimble, go into the industry where you're needed, and be open to trying new things, trying to work as potentially as an emergency veterinarian or wherever you actually feel the most comfortable, because ultimately what you initially started as, you may have to adjust just until we get through this crisis time.
Certainly, and there's a whole world of opportunity, although shrouded behind a veil of challenges right now.
No doubt, because listen, Joe, I would have never expected. I had the pleasure and opportunity to talk to you on Dog TV. So sometimes you don't know where you'll end up. You know, when I was in vet school, my two favorite species were bovine and canine, so cows and dogs. But I didn't know of any practices out there that only did cows and dogs. And so I didn't know where I was going to end up, but you know, where I have ended up has been awesome. So everybody out there, hang in there. It's going to get a lot better.
Awesome. One last question, and I know you're very busy, and I don't want to keep you away from your patients.
It's all right.
One last question is, this is the second time I've interviewed you, and you always have such a happy and fun demeanor to you. How are you personally, as a veterinarian and an individual, keeping yourself above the fray, reducing your anxiety, reducing, depression, focuses? What are you doing personally to keep yourself focused?
Listen, man, you're the first person that's ever asked during an interview, how are you actually doing, Courtney? Which is incredible, man. First and foremost, thank you for the question. I'm doing well. And my demeanor, I'm not like this all the time. So it's only when I'm talking to you, Joe. That's the only time I'm like,
that's good.
Right. But on a very serious note, I noticed that some people, and particularly healthcare professionals, experience something called moral fatigue, where you every day are bombarded with life and death decisions, and you understand that the decisions you make have broad range reverberations and implications among people, pets, and to the public writ large. And that's something we feel is very omnipresent, and it's with us every single day. And then now you amplify that in the era of COVID, where people on a daily basis understand that little decisions you make can have broader implications on the public writ large. Should I order takeout? Should I pet that dog? Should I go visit my grandmother? I mean, all of these little things, now you realize these are heavy decisions, and you can experience moral fatigue. And veterinary healthcare professionals and healthcare professionals are the most at risk for feeling that level of fatigue. So here are a couple of things that I always say will keep you hopefully morally fatigue free, or just keep you upbeat and happy. Is number one, I always say, reach out to your connections. Don't forget to reach out to other fellow veterinarians, friends, family members. Have somebody to talk to, even if it's through virtual mediums like you and I are talking right now. Two, do something what I call create a victory list. And I think we're very good at creating to-do lists. I got to do this, I got to do that. And you can feel defeated and discouraged if you don't get to everything on your list. So instead of creating a to-do list, create a list at the end of the day of all the things that you were able to accomplish. And it's what I call a victory. These are little small victories in the war of trying to do things. And then most importantly, make sure that you exercise your body. I know a lot of people are under these shelter in place orders, but I think it's obviously important to be socially responsible and physically distant from people, but make sure that you do something that you enjoy, you really, really enjoy, where you can just shut off that noise, or I should say that concern, that anxiety that you're feeling on a daily basis. Whether it's something as simple as yoga, meditation, crochet. I do not crochet, by the way, but whatever it is that you enjoy doing, just reading a good book, make sure that you take that opportunity to do something that you enjoy doing. But I would say those are the three things. Make sure you're connected. Make sure that you have a victory list, and most importantly, make sure that you have that off switch so that you can enjoy something that you enjoy doing.
I couldn't agree more. Absolutely love it. Thank you, Dr. Courtney. Where can people find out more information about you, follow what you're doing in the world of veterinary medicine, and follow along with your journey to see these beautiful crocheted scarves? I assume they're going to.
They're coming soon.
You're a surgeon. I mean, you have like.
That's true, right? During this quarantine, I've learned 3 new languages. I've done some crocheting of scarves. I'm now a chef. No, I haven't been able to do any of that, but I plan on it. It's on my list. But anybody who has questions, concerns, topic discussions, you want to reach out to me at Dr. Courtney DBM on Twitter, Instagram, my Vet Candy as well, where I host a show, Vet Candy Watch, and you could definitely find YouTube. There's any platform, but certainly Twitter, Instagram are the easiest. Don't hesitate to follow me. I'll follow you right back. And of course, check out Vet Candy as well. We've got some great content on there. And then, of course, there's surgical topics or discussions. Come hang out at VetSurge in Ventura, California. So if you find me, I'll find you right back.
Sounds good. Thank you so much, Dr. Courtney. Make sure dog parents out there to submit your dog to Dog Star. It's our chance for these dogs and just us to celebrate something fun. They submit funny videos of their dogs doing things. You know, we have a doggy Olympics since our Olympics got postponed. Dogs talking, dogs just being funny. So go to dogtv.com/dogstar. Submit your dog, and it can be seen across 70 million homes in the U.S. And if you haven't tried out Dog TV yet, go to dogtv.com/wecare to try your 1 month. A chance for you and your dog to relax, bond on the couch, watch some Dog TV. It can distract them, gives them some enrichment. Well, maybe you have to do conference calls with doctors like this. Dr. Courtney, thank you so much. Go check him out. Dr. Courtney, DVM. It's Courtney Campbell, DVM.
Absolutely. At Dr. Courtney, DVM. Spot on right there.
Perfect.
And honestly, Joe, thank you for all the work you're doing. Continue to be an advocate on behalf of pets everywhere. Dog TV. Listen, you guys are doing amazing work. And I think what I love the most about what you do is that there's real science behind it. We know it works. And it's real bona fide enrichment. So keep up the excellent work you're doing.
Awesome. Thank you so much, Dr. Courtney. Have a wonderful day. Stay healthy. We'll be praying for you. We'll be moving you forward. Support your local vets, guys. They definitely need you right now. Maybe send over a gift basket. You can't be there in person, but they're on the front lines. Every healthcare worker and first responder, you guys have our full support here at Dog TV. So thank you so much, Dr. Courtney. We will talk to you soon.
All right. Thank you so much. Take care, Joe.
Bye, guys.
Bye.